911 is more of a, when we're talking crisis, we're talking immediate, we're talking harm, self-harm, harm of others, where sometimes we have to transfer a call to 911. However,
and vice versa?
And vice versa. We get calls from the police as well. But our role is to eliminate that crisis for folks and give them the opportunity to talk through what's going on in their lives at the time, and hopefully give them a resolve or come up with a plan with them without giving them advice. What's happening is Behavioral Health Organization, which has been a generous donor to the crisis clinic for many, many years. Their funding has changed, and we are, effective 2020, our
January 1st?
January 1st.
Wow.
Absolutely. Our funding from them is going to decrease by 2/3, and that's a big amount of money for us. And
can you spell that out? Can you spell out the numbers for me when you say 2/3?
2/3. We have been getting $12,000 from them
a month.
A month, and that's also to cover the DCRs as well.
Oh.
And that is now decreasing, and we're going to be getting only $4,000 a month.
Oh, wow.
And so that will be in total. We're going to be covering the DCRs for a couple months into 2020, but that will be changing, and then the DCRs, their criteria is totally different, and it's something that we cannot provide.
Or BHO, so was that your main source of monthly funds?
Yes.
It was.
They've been very generous to us. And then, of course, we have private donors. The tribes have been very generous as well. Part of our role in the community is crisis intervention. That's a big one. Empowering people. We have about 45 volunteers right now. Our goal is to have at least 55 and 60 volunteers.
So there's a need.
There's a need. There's an absolute need. And we do have a training coming up, which was coming up on January 10th, and it runs for about 6 weeks.
How would, if people are interested, how would they get involved in that training?
They could go on our website, which is at crisis-clinic.org, or they could call the crisis clinic, and we could provide an application. And with the application and prior to training, what we would do is have an interview, and then it's a background check as well.